Good evening and welcome to Dr. Melissa Medicine Woman. I am delighted that you have joined me this evening, and we are going to be discussing how high should it be? Well, what am I talking about? Well, tonight we're going to talk about this little thumper in our chest, our heart rate specifically. And so before we get into that, let me go through my disclaimer. The show and all the content are for educational purposes only, not intended to diagnose, treat, cure, or prevent any disease or psychological disorder. A specific pharmacist patient or physician patient relationship is necessary before any medical therapies are initiated. Please consult your pharmacist, physician, or other qualified healthcare professional with questions about your medical conditions and before starting or using any dietary supplements, herbal remedies, exercise, or nutrition plans. And so tonight, as we discuss how high should it be, I was asked this question: how do you lower your resting heart rate? And so let me tell you how we're going to talk about lowering our resting heart rate and what it is. And let me give you a little bit more information about who I am. I'm Dr. Melissa Balizan. I am a pharmacist. I have over 26 years of experience in both the Eastern and Western medicine. I am your medication expert. I have over 52,000 clinical hours, and I speak with hundreds of patients a week, and I have helped thousands and thousands of patients optimize their health. My physician friends call me a de-prescriber because I do remove those medications that are not necessary for you to be taking, and we do really optimize your health. And so I am your concierge consultant pharmacist, and I'm delighted to be with you here this evening to talk about heart rate. And as I said, I got the question, how do you lower your resting heart rate? Well, first of all, let's talk about your heart rate and what it should be. So your heart rate really should be between 60 and 80 beats per, or 60 and 100 beats per minute. And how do you measure that? So you measure that by checking your pulse rate. Okay. So when you check your pulse rate, you can find your pulse here in your wrist. You can find it here in your neck. It's very easy. And so when you check it, what you should do is you should put your two fingers on that pulse point, and you should get a stopwatch or watch the clock. And you can do it for just 10 seconds. And you do want to be quiet when you're doing this because it helps you, but you count how many beats happens in 10 seconds, and then you multiply that by 6, and that's how many beats per minute. If you do want to hold it there for a full 60 seconds, you can do that. But it's much easier if you just do for 10 seconds and multiply by 6, or for 15 seconds and multiply by 4. Well, let's talk about, so when I said it should be between 60 and 100 beats per minute. So we used to say it was between 60 and 80 beats per minute is the average adult heart rate. Now, as you age, your heart rate changes. It usually gets lower as you age. But as you are in your adulthood, your 20s to your 60s, some people have a higher resting heart rate, and that can be in between 80 and 100. And that's okay to be between 80 and 100. So anywhere between 60 and 100 is good. Now, when we look at that number and we look to see, well, how can we lower our resting heart rate? So if your resting heart rate is high, in the hundreds or more, then there could be something underlying going on. And so I want to talk about the different things that could possibly be going on. We're going to talk about how to lower it. We're going to talk about how to keep your heart healthy overall. So when we talk about our heart rate, so our heart rate can spike in certain instances. So if we become stressed, our heart rate can go up. When we're exercising and we're running or jumping, our heart rate can go up. Okay, so some ways that we can decrease our resting heart rate and keep it at a lower level. So if you're experiencing a higher resting heart rate and we want to lower it, some practices that you can do on a daily basis to help to lower that. So we think about calming our system down, and we think about deep breathing techniques. So you can sit And I like this one. It's very simple to do. What you do is you sit, you take a nice deep breath in for 4 seconds, and then you hold it for 4 seconds, and then you let exhale for 4 seconds. So it's and you do that a couple of times, and that's a lot of great things that are going to be happening for you. You're going to decrease your resting heart rate. You're going to clear your mind. You're going to refocus, and it can do all kinds of things. If you're in a stressful situation, a panicking situation, then lowering your resting heart rate is very easily done by breathing techniques. So that's one deep breathing technique you can do. Also, going for a walk on a consistent basis. Typically, it's best if you're trying to lower your heart rate, we want to get away from an urban area. So you don't want to be heightened with stress there's cars out here, or you're going to be run over, or you have to keep constantly watching out. Now you want to be conscious of your environment. But if you can walk in an area that is not as populated, then the chances of your resting heart rate being able to go down is very good. Another way to relax your heart rate is to relax by taking a nice warm bath. Okay. And just sitting there and doing your breathing techniques and allowing yourself to be calm. And this is actually one key self-care thing that we can do for ourselves. So taking time to make sure that our body's in check, taking time to breathe deeply, taking time to go for a walk, taking time to sit and just enjoy a nice warm bath. These are all great things for your heart rate, and for self-care. Now, let's talk about some things overall for your heart, okay? Ways to keep your heart healthy and keep that resting heart rate in good check. So exercising on a routine basis, or movement, as I like to say. So that E word, I think, has been overutilized. So we're going to say movement, and we talk about functionally moving, because I want you to be able to functionally move up and down the stairs. I want you to functionally move down the hallway. We want to be able to pick up and carry our luggage, if we want to, down the hall when we're 90 years old. Okay, so exercising and moving, those isometric exercises, expanding and contracting those muscles on a routine basis, is good for your heart as well. Hydration. We've talked about this in the past before. Drinking water, making sure you're drinking plenty of water, can help your heart. Now, there is a study that's been done that if you need to quickly lower your resting heart rate, that if you drink, it's 300, about 300 mLs of water a day, 300 mLs, or actually about 330 mLs. So if you divide that out, so 332 divided by 8 is 4. So about 40 ounces of water quickly, you can lower that resting heart rate, drinking 330 mLs of water, because it's slowing down the process. Now, hydration is good. Now, overall, we want to keep ourselves hydrated. We want to keep our heart hydrated. Our heart needs water. Our body needs water. And so this hydration can help keep our heart rate at a good, nice, steady resting rate. Okay. Now, our heart rate spikes on certain instances when we need it to, when we're in that situation of stress, when we're in that situation of flight or fight. When we need that specific response, our heart rate can go up when we need it, but we want it to be at a good, safe level when it's resting. Limiting the amount of stimulants. So when we talk about stimulants, I'm talking about caffeine, which caffeine can dehydrate you. So limiting the amount of caffeine. Now this is in coffee, tea, soda, the amount of caffeine that you're putting into your body a day, because more caffeine can increase your heart rate. So you want to keep the amount of caffeine to a minimum for a good, healthy heart. Alcohol in moderation can be good. Alcohol in excess can be bad. So you want to limit the amount of alcohol if you do drink. You want to make sure that your alcohol is something that you're doing. Maybe it's in a social situation. You sit and you enjoy a glass of wine or a beer with your friends, and that's fine. What I want you to do is not do to excess, because that can increase your heart rate, because it takes harder and longer for your body to pump out and get rid of that alcohol when you have excess. And there's other things with alcohol excess as well. So of course, when we talk about on Dr. Melissa, we talk about medications, and medications can interact with your alcohol. So that's a whole nother story. So for your heart, limit the amount of caffeine, limit the amount of alcohol. Well, what can you have? You can have great food, great nutritious food that's nourishing your body. We've talked about the Mediterranean style before. Following a Mediterranean style lifestyle or nutrition plan has been very helpful, and that is heart healthy as well. Lots of greens, lots of vegetables, good, healthy food for you. And the good, healthy antioxidants in this food that we're eating. So making sure that you're getting the right amount of omega-3 fatty acids. You need a little bit of fat. Making sure that you're getting your polyphenols, making sure that you're getting your vitamin A, your dietary fiber, and of course, vitamin C. So these can come from the foods that we eat. The omega-3s from your fish. The polyphenols come from tannin and tea and coffee. You do need a little bit of that. Vitamin A comes from green leafy vegetables. Your dietary fibers come from your whole grains, your nuts, and a lot of your fruits and vegetables. And vitamin C comes from your citrus and some other fruits. And you do actually get some vitamin C from your green leafy vegetables. So nourishing your body is good for your heart. Okay. Now, the next thing, we've talked about this before, sleep, getting enough sleep. An adult needs 7 to 9 hours of sleep a night. When we sleep, our body resets itself. It goes through and it fixes processes that are broken, and it resets things. And if we're short-circuiting ourselves, we're not getting enough sleep, we are causing harm to our heart. So make sure that you are getting enough sleep. And if you want to know more about sleep, then please check out that episode that we did not too long ago on sleep, how much you need, how to make it better for you, benefits of sleep. To help your heart, we want to reduce the amount of stress and conflict in your life. Stress can come from work. Stress can come from caring for loved ones. Stress can come from financial burdens. There is all kinds of causes of stress out there. And these affect our heart, our body, because we have to deal with it. And it's an emotional process for us. And our emotions grow up, our heart rate goes up. And so we want to see that we can try to find a way to de-stress. And I don't want you just to go in to drink alcohol to de-stress. If you're doing that, then let's chat, because that's not the best way to de-stress. You need to find a good, healthy way for you to de-stress. Is that going for a walk? Is that taking a bath? Is that doing a puzzle? Is that talking with a friend? Those are just a few examples. I got a whole bunch more. So taking time to de-stress. Now, stress is going to come and it's going to happen. But if you find ways to de-stress and have ways to deal with that stress so that you're not putting your body in that fight or flight system all the time, so you're not overworking your system, not overworking your heart, then that's so much better for you. Now, there's certain instances where we need that fight or flight system to kick in, okay? But overall, we want to keep our stress level in check or have ways to deal with it, especially if we have a stressful situation or a stressful job or stressful caring or finances are going wrong. All of these things, find ways to de-stress so that you can keep your heart healthy. Getting outdoors, going outside and enjoying nature. Is that going for a walk? Is that just going out into your grass and grounding yourself, standing there, being grateful for what you have, being grateful for the ground and the grass and the air and the sky and the flowers and the trees and everything around you? Taking time to spend in the sunshine, getting your vitamin D, absorbing nature is key. It's very, 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 very healthy for your heart. Ways to relax. So this kind of falls in with the stress. So finding ways to relax from stress. Some people do meditation. I gave you some examples earlier, but another way is meditation, sitting and meditating. You can go through a guided meditation, or you can do your own. You sit and you focus on your breath. You focus on breathing. You can do it for 30 seconds. You can do it for a minute, 2 minutes, 3 minutes, 5, 10. You can do it for hours. Spending time in meditation is going to help to lower your resting heart rate. So when we talk about when you have a higher heart rate, so sometimes when you have a higher heart rate, let's talk about the health risks that are possible. So when your heart rate is higher, you may have a tendency to have an increased blood pressure. You may have a tendency to have changes to the calcium usage of the cells in your heart. You may have inflammation and oxidative stress, and you may even have some blood vessel dysfunction. Now, these are things that a study was done a while back that suggested that if you have that higher heart rate, you have that risk of having those. So if you can lower your resting heart rate, then that's overall better and puts you at less risk for those issues. Now, ideally, we talked about the many things that can affect your heart rate. We talked about activity. We talked about nutrition. We talked about decreasing your stress, getting enough sleep, controlling relaxation techniques. Now, other things that can affect your heart rate as you age, we talked about that a little bit. I talked about at the beginning how your heart rate changes as over time. So young, very young people have a higher heart rate than do toddlers and adolescents and adults. It changes over time. Now we're talking mostly about adults here. So between 60 and 100 beats per minute is what the average heart rate should be. Now, sometimes we need to increase that heart rate. Now we want to max our heart rate out. And we do this when we're doing certain types of activity, but you only want to go to a certain point, okay? So if you increase your heart rate too much, even while doing those movement exercises, it can be detrimental for you. So you want to be careful and pace yourself, and you check your pulse when you're running, when you're doing things, when you're jogging, when you're walking, and that keeps you in check to make sure that it doesn't go too high, okay? So normally, when you're doing strenuous activity, a range can go up to 70 to 85% of your maximum heart rate, okay? And so you can calculate that based upon, so somebody who's 45 years old, the target heart rate is anywhere between 90 and 153 beats per minute. And so your average max heart rate would be 175 beats per minute. Okay, so you can kind of do that, and you can find a chart of in the younger you are, the higher your target heart rate is. Okay. And as you get older, of course, your target heart rate is less. And so your max is going to be lower. Okay. So I'm giving you a lot of things to think about tonight when we talk about heart rate, ways to why it could be high, things that put you at risk for being high, ways to lower your resting heart rate. And I want to make sure that I do go through a couple of other disease states that are possible. We didn't talk about all of them. I do want to mention just a couple more, because a higher resting heart rate specifically, another study showed that you're more likely to be at risk for asthma, sleep apnea, stroke, coronary artery disease, high blood pressure, diabetes, and arrhythmias. Now, these are some serious things, okay? And so we want to make sure that we can get you into a good, safe heart rate. And so if you've done these techniques that we've talked about tonight and things haven't changed for you, it may be time that we have a chat and we talk about what is the best thing for you. Do we need to put you on a medication that helps to lower that resting heart rate, to put you at less risk of having asthma, less risk of having a coronary artery disease, less risk of having a heart attack, less risk of having high blood pressure? All of these things are possible, okay? And so we weigh the risk benefit with our health, no matter what we're doing. And as we're going through and looking at that, we want to make sure that our heart rate's in check, because we want to do the best thing for our ticker here. We want to do the best thing for our ticker because our ticker keeps us going. And when we're looking to make ourselves better, we look at the whole picture of health. We talked a lot about the physical tonight, about the heart. And we did touch on a few things of mental and emotional when we talk about meditation and we talk about relaxation techniques. Now, these are things are part of whole body health. And whole body health is the right next step for you if you're looking to lower your resting heart rate that's too high. If you're looking to be better at who you are and be healthier on your health journey. If you're looking for recipes, if you're looking for ways to learn key techniques on how to be healthier and to stay healthier so that you can be vibrant and vital and live the best life that you can live now, I invite you to take a look here at this website I have just for you. It is drmelissabalizan.com/TV, just for you who are watching today. And let me pull it up for you as well here, just so that you can see it on the screen. So it is drmelissabalizan.com/TV. That is the right next step for you to start your health journey today, to continue your health journey, to stay healthy and happy and vital so that you can spend time with your loved ones, whether that's your kiddos or your grandkids or your spouse or your significant other, hanging out and enjoying life and making sure that you live your best life now, because you only have one body. You're only given one health. So do the best with it now. Protect this ticker. Protect your heart. Start with whole body health today. This is Dr. Melissa, the Medicine Woman. I am your medication expert, and I am delighted that you joined me tonight. Stay healthy and happy, and we'll talk soon. Take care.